The Osun Health Insurance Agency, OSHIA, has trained accredited healthcare providers in the state on emergency care. The training kicked off on Tuesday at Staff Development Center in Osogbo, the capital of Osun, where nurses, doctors, among others, are in attendance. Speaking with newsmen, the Executive Secretary of OSHIA, Dr. Razak Akindele, said the two-day program will serve as an avenue for continuous medical education to address several reports of mismanagement of treatment by healthcare providers. He noted that the training has been fully packaged to reflect on what healthcare provider has forgotten and what to do during emergency issues. Dr. Akindele assured enrollees that there is going to be better healthcare delivery in the state after the training and meeting with the providers.
Yes, this gathering is actually a routine thing that we do. Call it Providers Forum, where we, as the regulator, we meet the providers, the healthcare providers, and discuss issues in healthcare, discuss way how to manage it. Now, we have decided to make this one a two-in-one, a training session, apart from the normal meeting that we have. We have had a lot of reports of some mismanagement of patients, and I think it should serve as a continuous medical education. We should come together and we discuss some of these areas of mismanagement. More of them are from the obstetric care, emergency obstetric care, newborn resuscitation, some emergency cases. So we have packaged this training to reflect all these areas where people seem to have forgotten what to do when you have some emergency issues. That's why we're having this. So it's going to be a two-day program. Today is dedicated to training of personnel. You see that only doctors and nurses were invited for this particular one. Tomorrow we will come together and discuss issues that has to do with operations on the field regarding the enrollee. What this will mean to the enrollee is that there's going to be better care for them. After having this training, after having the meeting, they're going to experience better care for them. And there will be, we as the regulator will also be, our mind will be at rest that what the providers are giving to our people are the things that they should do.
In his own remarks, the Executive Secretary, Osun State Drug Management Agency, Dr. Said Olarewaju, said the training will further open eyes of the healthcare providers to the modern-day treatment techniques in the health sector. He encouraged Osun residents to take their health issues seriously by visiting accredited hospitals to seek treatment.
Ojútẹ́mi fi wo ìdánilẹ́kọ̀ọ́ ní pé ó ṣe àǹfààní fún àwọn òṣìṣẹ́ onímọ̀ ìlera gidi gan. Gẹ́gẹ́ bí wọ́n ti máa ń sọ, ìmọ̀ ìlera àbí sáyẹ̀nsì kò dúró sójú kan, ojoojúmọ́ ni nǹkan ń tẹ̀síwájú sí i. Irú ìdánilẹ́kọ̀ọ́ yìí ó ń jẹ́ kí wọ́n á mọ àwọn current trend, àwọn bí wọ́n ṣe ń ṣe ìtọ́jú eléyìí tó wà níta lọ́wọ́lọ́wọ́ ǹsẹ̀. Tí irú ìdánilẹ́kọ̀ọ́ yìí bá ń wáyé lóòrèkóòrè, ó mìíràn pé ètò ìlera ní ìpínlẹ̀ Ọ̀ṣun ó máa kún sókè sí. Ìmọ̀ràn tí mo lè gba àwọn òbí àti gbogbo ará ìpínlẹ̀ Ọ̀ṣun ni pé tí àìsàn kankan bá ń ṣe wá, tá a bá ní ìpèníjà àìlera, ẹ má jẹ́ ká dira wa mọ́lé. Ẹ jẹ́ ká lọ sí ilé ìwòsàn ìjọba níbi láti rí àwọn akọ́ṣẹ́mọṣẹ́ onímọ̀ ìṣègùn òyìnbó tí wọ́n á lè sọ ohun tó ṣe wá, tí wọ́n á dẹ̀ lè sọ ohun tí ó jẹ́ ọ̀nà àbáyọ fún irú àìsàn oríṣiríṣi tó wà bá ní ìṣòro ní nítorí èyí.
Also speaking, the consultant cardiologist Dr. Adebiyi Lukman Obasanjo urged all agency establishments to emulate OSHIA in sensitizing people in church, mosques on basic life support skills. Dr. Obasanjo affirmed that OSHIA has contributed positively to the healthcare delivery in Osun, and the training will also triple their activities in the rural areas. He emphasized the need for every person, irrespective of their work, to have basic life support knowledge to be able to address the issue of cardiac arrest, among other in emergency situations.
It's an extremely important program. You realize that patient died of needless reasons, of which many of these deaths can actually be reversed if our healthcare professionals have good knowledge and skills of how to resuscitate human right from neonatal life to the adult life. So this training today, we're going to experience a practical hand-on training on how to resuscitate neonates, adults, and then, of course, all walks of life. And of course, the teaching, all the people that are invited for the lecture, these are people who are actually eminently qualified, those who are anesthetists that have been part of the training all along. Now they are going to teach people on the basic life support and then advance to the advanced cardiac life support. Of course, we expect that everybody, whether you are Mama Lata or whatever you may be, to be able to do basic life support. And basic life support, all you need is just your hand, your ability to recognize somebody who is having cardiac arrest and start immediately how to resuscitate the cardiac compression, giving rescue breath and all of that is going to be taught. We all can see that recently there was a viral video of somebody who just collapsed in the church and died, assuming that people who know how to resuscitate are there. They will be able to start resuscitation until medical practitioner comes. And we have always said, where you have at least 20 or more people gathered, the risk of cardiac arrest is high there. So everybody needs this experience, whether you are a doctor or you are a nurse or even you are a layman, a teacher, a cleaner. We all should know how to resuscitate, because you don't know when next somebody is going to have cardiac arrest at your side, and the life of that person depends on you to be able to make that person well. I mean, you can see people came here from different parts of the state, from Nook and Cranny, from the urban center to the rural center, and this information is going to trickle down the line to all those rural areas. So where you think is even forgotten, remote village, you have healthcare practitioners from all those places here. So which means this experience we are talking about go far into the grassroots, and a lot of things happen in that grassroots. Before they bring the patient to the teaching hospital, so much will have been done. But now, having the ideal way of resuscitating now, recognizing somebody who is going to have cardiac arrest and immediate recognition of cardiac arrest is important. Once they all know this, they can resuscitate a patient and keep that patient alive till the patient gets into the teaching hospital to continue. So this is a very good initiative, and we have been saying it because I'm also part of resuscitation team at the teaching hospital. So we have been encouraging all agencies, all establishments to inculcate this habit that the OSHIA has just done today, to make sure that everybody, whether in the church, in the mosque, or whatever it is, to be able to do the basic life support. At least that will help us to prolong life.
Ayobami Abidoye reporting for Army Loaded.